Now, unfortunately, as we already talked about, the vast majority of the patients with myeloma is going to have the myeloma come back. And we have to, at that point, do something different than what we did in the beginning. And thankfully, we have lots of different drugs for treating myeloma, as Dr. Rajeeve already pointed out. We have, the immunoimids, which is the pomalidomide and the Revlimid. We have what we call the proteasome inhibitors, which is the Velcade, the Kyprolis, and the Ninlaro. We have monoclonal antibodies like the daratumumab or Darzalex. Now, what we end up having to do is to create mixes and matches of these drugs to develop 3 drug combinations that we can use one after the other to control the myeloma. The way we do that is ensuring that patients at each time they need a new therapy, we come up with a combination that contains a drug that the patient has not seen before. That way we are able to get the maximum benefit out of each of these medications that we have. Now, obviously, you heard about the CAR T cells from Dr. Rajeeve, and I won't go into that, but I think the immunotherapy has been one of the major advances that have happened in multiple myeloma in the recent past. And one of them is a bispecific T-cell engager. Now, all these different immune therapies rely on somehow making the T cells that are already in the patient, and these are the immune cells that can destroy the cancer cells, somehow make them see the myeloma cells better and kill them. Now, in the CAR T cells, you heard about how the T cells are modified outside the body and infused back in so that they can recognize the myeloma cells and kill them. Now, the bispecific T cell engagers or bispecific antibodies use a different approach where they use basically give these antibodies that can actually recognize the tumor cell and also recognize the T cell, in a way dragging them together so that they can actually now, the T cells can recognize the myeloma cell and kill them. I won't go into all the details, but it's important to note that we have several bispecific antibodies in clinical trial that are targeted towards very different proteins on the myeloma cells. One of them is already in the clinic called teclistamab or Tecveli, and that we are all starting to use in patients.